The reason I wanted to talk about this one was they've gone to a lot of different sources of information, but they haven't told me how they're validating their information and confirming that their insights are correct. And so that's the next step I want to see out of Banner Health or somebody. Is great to use natural language processing to pull insights out of the text data, but have you validated it? Have you proven that it is an insight that is actionable? And net promoter scores are important, I know, to the marketing team, to a lot of folks who look at how to retain a population, retain consumers, but is 86 really that different than low 80s? Is it statistically enough of a difference to really differentiate in the market? So my interest is in the natural language processing. It's been such a promise for years and years, and yet it has failed on a number of levels. Will it work here? And so I want to see the next level research. I want them to come back to HIMSS next year and talk about the validation of the insights.
It's interesting. When we talk about digital engagement, a lot of it is around that engagement. And they cite two things. As you said, the net promoter score for their imaging group went from 80 to 86. And that is one of the things we look at. Are the consumers, are they captivated? Are they enthralled with your service level? And I think in most things, an 80 to an 86 would be considered a significant move. Those are people who are actually recommending your service to others. The results that have also increased 40% in engagement with the survey platform compared to 2019. So I guess they're collecting more information from the consumers. But I've heard this, and you bring it up, and it's a valid point. I heard this in a lot of different areas. We have all these digital initiatives going on, and we don't put it through the same rigor that we do clinical studies or anything to that effect. And when we're talking about digital therapeutics, that's going to be really important. But when we're talking about just getting them to use the app and to engage the doctors more through these digital tools, or to do more online visits, do we need that kind of rigor, or do we just want that information to know what's being effective?
Rigor at a higher level than we've had. I think there's still too much thumb in the wind type things. We do confirmation bias is a dangerous thing, as we see in so many other settings. And I think confirmation bias in this setting really has to be eliminated for the systems to get great and actionable insights from the data. You don't have to do it at every system for everything, but it'd be nice if some folks were to come out with some stuff that you could say, okay, now if we do this, recognizing that every system is different, but we can extrapolate and say, this had great validity at Banner Health and they proved it, let's do it at ours, and we don't have to go as deep to prove it. We can take 3 or 4 measures that show that we're trending correctly from it. But otherwise, to me, it's still thumb in the wind.